Thank you so much, Joel. As mentioned, I'm Salima Meherali. I'm assistant professor in the Faculty of Nursing. Thank you so much for giving me the opportunity to share our systematic review study findings on digital literacy, empower adolescent girls in low and middle income countries. Globally, approximately 1.2 billion people are under the age of 10 to 19 years, and 90% of whom live in low and middle income countries. And in those resource-limited settings, girls face distinct challenges across multiple health, social, and economic domains. Adolescence is a critical period in life during which people experience extensive biological, psychological, and social changes. To remove the structural barriers that young girls face and ensure they are involved in decision-making, they should have the information, services, and opportunities needed to live to their full potential. Digital literacy is a great enabler for the empowerment and development of young girls across a wide range of areas. These include engagement in online education, both formal and informal learning, access to critical information, and support related to health and well-being, and searching for employment and career information. This holds great importance for young girls and women's empowerment, especially in settings where the women lag behind the men and lack the necessities to live. Despite gendered inequalities around mobile ownership and internet access, adolescent girls and young women in low and middle income countries are increasingly gaining access to internet and digital technologies. Mobile health interventions are also becoming more common in developing countries. Evidence suggests young people are responsive and enthusiastic to digital solutions related to health, education, and employment opportunities. So the purpose of this systematic review was to assess the range and nature of digital literacy interventions implemented to empower adolescent girls in low and middle income countries and identify evidence about adolescent girls' access to and use of digital technologies. The further objectives of this review were to identify and evaluate the effectiveness of digital literacy interventions employed to empower adolescent girls in low and middle income countries, understand the approaches and strategies used to delivery of digital literacy interventions, and identify knowledge gaps in those contexts. This systematic review was conducted following the preferred reporting item of systematic reviews and meta-analysis PRISMA guidelines and included experimental, randomized, non-randomized controlled trials, observational studies, and qualitative studies. The studies that used case reports, case series, editorials, opinion papers, thesis papers, and review papers were excluded. Studies were included on adolescent girls aged 10 to 19 years living in low and middle income countries as defined by World Bank. The studies with broad age groups were also included if they included the subgroup analysis that included girls in the age range of 10 to 19 years. Studies that describe the access to and interventions to increase access to digital technologies, interventions to improve sexual and reproductive health and rights through digital or mobile technology, and interventions to empower adolescent girls, that is education and economic development through digital technology or digital literacy were included. The protocol of this review was registered with Prospero. Following a full text review and consultation among the authors, 35 articles were included in the final review and analysis as shown in the PRISMA diagram over here. We assess the methodological quality of quantitative and qualitative papers using the mixed method appraisal tool. The majority of the studies scored moderate to high for interventional studies and poor to high for observational and qualitative studies. Studies were not excluded based on assessment scores, as the purpose was to examine and gain insight into the existing research in this field. We thematically analyze and put up the major findings under the thematic areas of digital literacy to empower adolescent girls in low and middle income countries. The studies included were categorized under three headings as listed in this slide. Digital strategies and interventions most commonly reported in the studies which are included in the review to empower adolescent girls were text messages, mHealth or mobile health, mass media, website development, and mobile-based games. Most of the studies focused on the empowerment of adolescent girls in the area of sexual and reproductive health. Total of 33 studies reported sexual and reproductive health empowerment through digital health literacy. These studies implemented and evaluated the impact of digital literacy interventions on adolescent girls' sexual and reproductive health, STIs, HIV knowledge, usage of contraceptives, and decision-making related to contraception, and treatment and promotion of reproductive health care. Studies reported that internet-based and mHealth interventions lead to sexual and reproductive knowledge gain among adolescent girls. Mobile health or mHealth interventions such as short messages and mobile apps are also identified as effective tools to increase sexual and reproductive health knowledge of adolescent girls. The digital literacy sexual and reproductive health intervention also had a positive influence on young girls' attitudes towards sex-related issues and towards providing contraceptive services for unmarried girls. Studies also reported that young girls prefer to use the internet to access sexual and reproductive health information because of its ease of access, low cost, anonymity and privacy, and trustworthiness. Studies reported that information and knowledge adolescent girls gain through digital media empower them use this information for the prevention of STIs or HIVs, for decision-making on reproductive health matters, for self-knowledge, sexual identities and practices, and prevention of unplanned pregnancies. Studies also reported that digital literacy improves the utilization of reproductive health services, such as family planning, antenatal care, childbirth, postnatal care services, and childcare among teenager mothers. Only 3 studies reported the use of digital literacy for health information and healthcare decision-making. Many adolescent girls use the internet to access health information. Digital media such as TV, radio, internet, and mobile phone are used to access health information and use the information for healthcare decision-making. Through digital media, youth keep themselves informed and connected with the outer world. One of the study reported the development of Information and Communication Center in a village in Pakistan, where women could access information through online and offline resources. Young women who participated in the project felt satisfied and empowered, as otherwise the healthcare staff rarely took young girls' concerns seriously. Young girls' level of information regarding knowledge about general health issues also increased, such as information about the danger of self-medication, use of disposable syringes for injection, information about causes of hepatitis B and C, and regarding garbage disposal. So through digital literacy health information, this information has been reached out to disadvantaged young women with low literacy level. We found only one study that explored the impact of digital literacy on adolescents, girls' social and educational empowerment. The study examined the difference in the internet access of adolescent girls with their academic and psychosocial attributes. The study found that girls with low income, no internet access reported significantly lower scores on all dimensions of digital literacy and various dimensions of development, including academic performance, aspirations, perceived efficacy, self-esteem, and family and peer relationships. On the other hand, low-income girls with internet access did not show significant difference from non-low-income groups across all dimensions. This systematic review is the first of its kind that has aimed at identifying the effectiveness of digital literacy for empowering girls in low and middle income countries. The findings not only highlighted empowerment in sexual and reproductive health, but also gave an insight into the role of digital literacy in promoting general health information and the educational and social aspects. However, a more complete understanding of the role of digital literacy for educational and economic empowerment is required to strengthen the evidence base in overlooked areas. In addition, more studies are needed for girls from different cultural and ethnic backgrounds and how parents with different cultural and ethnic backgrounds support the use of digital technology to empower their girls. While on one hand, digital literacy contributes toward the empowerment of the adolescent population, it also directs them in a negative direction, where the youth engage themselves in acts including online harassment, sexual exploitation, cyberbullying, and pornography. Young girls are at greater risk of digital harm. So more studies are needed to explore how these digital risk and harm reduce or restrict adolescent girls' digital media use by parents, spouses, and gatekeepers. There's a need to understand the challenges of data privacy, technological literacy, linguistic competency, and phone access to address the barriers impeding access to digital technology by adolescent girls in low and middle income countries. Majority of the studies included in this review were cross-sectional observational studies Though these studies help in gauging a snapshot of the exposure and outcome of a particular time, they do not allow to identify a temporal relationship. Thus, the cross-sectional studies cannot tell the long-term impact or effectiveness of digital literacy on empowering adolescent girls in low and middle-income countries. In addition, the interventional studies were not homogeneous in terms of intervention used and outcomes, so therefore pool estimates and meta-analysis could not be performed. The role of digital literacy in empowering adolescent girls living in low and middle-income countries is an emerging idea. It not only plays a role in improving the sexual and reproductive health outcomes, but also contributing to improve health-related and educational outcomes and decision-making. The finding from this review can be used as a ground for developing new evidence-informed interventions, policies, and practices for girls in low and middle-income countries. This review is now published in Frontiers in Public Health Journal. I would like to acknowledge other researchers who are part of this review and as well as SHRC for the funding to conduct this review. Thank you so much.